Very often we see patients who look so sick and toxic, but all their blood reports are normal. On the other hand, the patient looks like absolutely healthy and his blood reports are a mess. So, what do we treat here? Do we treat the patient or do we treat the reports only?
Welcome to The Waterfall,
a video podcast and community in which we explore well-being, sustainability, the arts and technology.
In this episode, Kaberi and I hear from Dr. C.M. Pradyumna and Dr. Sabitha Pradyumna.
Both are MDs in Ayurveda pharmacology. They have been running the Prasida Ayurveda Clinic in Kolkata, India for over 20 years.
We asked them to imagine a society which was completely focused on well-being rather than on growth and profits, and tell us what differences they thought we would see.
Unnecessary tests, unnecessary hospitalizations, all these could be avoided if you don't go towards the profit making kind of health care. If the intention is to restore health, if the intention is to establish a healthy living, then the set of guidelines are different. If the intention is to make profit and go that way, then there is absolutely no emphasis on dietetics, lifestyle, do what you want. Come here if your health fails, which is going to happen sooner or later.
One of the common cases which we get is raised creatinine levels. And once the patient visits the nephrologist, if it crosses, say 2, 3, or even if it reaches to 5, they are very scared and they either rush to dialysis or ultimately the transfer. But if they are more focused on the functioning of the kidney regarding the urine output, regarding the physical symptoms of the patients and other parameters, rather than focusing on this one specific parameter of creatinine, things would have been different. Because they will be very scared once it crosses the higher upper limit. And here in Kolkata, you can get different labs with different higher upper limits. So, but many patients, their urine output is all right. They do not have any other symptoms of kidney failure or things like that. But you are scaring the people. So once you are focused, if a proper, if a nephrologist or if, for example, whoever, if a general physician also, if they say that these are the symptoms wherein you should be careful. If these symptoms are there, then you approach your doctor. In case if there is a frothy urine or the urine output is less, or give them some symptoms wherein you should approach the doctor. Then things would have been much more different.
It becomes so it becomes very mechanical rather. So what we do in such cases is ask the patient to monitor for these symptoms, monitor blood pressure, hemoglobin. There are very good methods in Ayurveda to keep the building up of potassium in the blood, which is the immediate risk factor in a renal condition. So a person who was supposed to start dialysis 10 years ago he did not need dialysis for 10 years when under Ayurveda. 10 years is a huge time. So these are some things which Ayurveda can contribute in a much comprehensive way in managing many disorders.
This reminded us of our own experience with my father's dementia, which we shared in our documentary You Must Be Nuts. Initially, for several years, he had been taking the same pills every day, including statins for cholesterol, a pill to lower his blood pressure, aspirin, and an addictive antacid to counter the side effects of the aspirin.
There seemed to be a whole ecosystem of pharmaceutical companies, insurance companies, and medical representatives, all profiting from this model. So we asked the doctors if they could share more examples of how treatment focused on well-being is different from treatment focused on profit.
Simple. Let us go to a very simple condition of blood pressure. The same condition is with the blood pressure, sir. Once you go to the visit doctor, when doctor is measuring, you see that the blood pressure is raised, you prescribe a medicine. Rather than doing it, ask the patient to monitor for a week and take an average and then start medication. That makes a lot sense.
The patient monitors his blood pressure in 3 positions: lying down, sitting and standing, 3 successive days in a particular time frame between 6:30 to 8:30 in the evening, so that is when the maximum blood pressure occurs in a 24-hour cycle. So 3 consecutive days, 3 positions every day, the reading is tabulated. End of the month, we have plenty of readings. We can see whether it is consistently high, consistently low, or fluctuating. And many times we see that patient does not require medications. So this unhurried approach means so much to the patient. Otherwise, for life, they will be on medicines. They will not be able to come out of that. Same applies to thyroid conditions, parathyroid issues. Diabetes. Patients come to us telling that my parathyroid hormone is higher and operation is the only way out. That is the standard remedy. Take out the thyroid gland and supplement hormones as required. So, parathyroid hormone, there is no equivalent for that in Ayurvedic understanding. So, the patient's symptoms, treat the patient's symptoms according to Ayurvedic understanding of the condition over a period of 1 or 2 months, and you can see parathyroid hormone coming towards normal. So, the patient does not actually require surgery there. I don't know about parathyroid hormone, but when I treat according to the patient's condition, parathyroid hormone is normalizing. We've seen plenty of cases where, for example, someone's prostate specific antigen was more than 200, 220 or so, which means he has prostate cancer. And this serum PSA is the method to assess the health of prostate. Even if he is subjected to radiotherapy or chemotherapy in oncological care, serum PSA is the method to assess whether he is improving or not. We have an example where we purely understood the condition according to Ayurveda, started the treatment from 200 plus, it came to 170, 120 and 74 or something. Should the oncologist not be interested to know what the patient is doing? He was not. He still insisted on the surgical management of the condition, radiotherapy and preventive care chemotherapy.
With Obhi's father, we saw that his treatment was divided between a GP and various specialists who did not seem to communicate with each other about his treatment. We also saw his mental health consultant struggling to help Obhi's father while navigating the side effects of all the drugs he had been prescribed.
This compartmentalization, the sidelining of traditional and indigenous medical science, and limited awareness among doctors of the connection between nutrition and health, all stem from the 1910 Flexner Report. In any case, unlike Ayurveda and other traditional medicine systems, Western medicine does not take a holistic approach. So we asked the doctors whether there could be a way to combine Ayurveda with Western medical science.
We are using the knowledge of Ayurveda and integrating it with all the modern diagnostics so that we can make the patient understand what the condition is and what are the possibilities through which we can treat a specific disease through the Ayurvedic method.
Ayurveda is a comprehensive system of healthcare. It has its own fundamental basis. It has its own theories, laws, way to assess clinical conditions, everything. Virtually, it's a complete system of healthcare. Like any other system of healthcare, Ayurveda also has its own limitations. There are possibilities, there are limitations. So where these possibilities are there, like in autoimmune conditions, where the allopathic system sees limitations, the so-called gray areas, where Ayurveda is doing good, that is exactly where the patients benefit very tangibly, subjectively and objectively, as I mentioned, because of availability of modern diagnostics. So we can run the tests as required in every clinical condition. We can assess the progress or otherwise based on what prescription medicines are going on. Purely Ayurvedic prescription, we as an Ayurveda Acharya, we can assess the progress. But when it comes to objectivity, it is better to rely on modern diagnostic, either biochemistry or imagery. It can be MRI, USG, it can be different kinds of scans, it can be different kinds of blood tests. You can see we are making progress. The patient is, also convinced in both ways. Just the doctor being happy about the progress doesn't mean much to the patient in today's world of Google search and everything. So here is a situation where people can get to see the biochemical equivalence of what progress they are making, and also look into their own health status and see what progress is happening. So when both ways patients are benefiting and they can see that they are benefiting, it becomes a successful way to practice, or a scientific way, as people put it. So where do we integrate these understandings? So unless both the systems know about each other's sciences, it will be difficult to make progress in the interest of humanity. So you have something very valuable here, but can't be interpreted in terms of modern technical terms. Does that mean it is useless? So we believe in, when you when NASA goes interstellar and all, the main aim is to find intelligent life outside Earth. They found intelligent life in India. They destroyed it, isn't it? The Vedic civilization had everything, every science, mind, body, you name it, you have it. Architecture, shipbuilding, textiles, virtually every field was, it had reached a stage of maturity. So blindly destroying pre-existing systems of knowledge is doing harm to the humanity. Someone may make dollars out of it now, but if you see the long term of human existence, you will be really depriving the humanity of the good which accumulated through many, many millennia. So that is where integration is necessary. Understanding each other's sciences are necessary to contribute to the humanity's goodness. We want to take the clinical Ayurveda to the people. There's so much Ayurveda can give to the world of medicine. Somewhere a collaborative effort is necessary to understand the beauty of what Ayurveda is. So there's a lot more that can be done with Ayurveda.
You can find out more about the integrative approach of Dr. C.M. Pradyumna and Dr. Sabitha Pradyumna on the website of their clinic, prasida.com.
You will find the link in the description of this episode, along with the links to watch our documentary You Must Be Nuts and Justin Smith's documentary In the Shadow of Flexner.
The next episode of The Waterfall will be our first slow travel episode.
We will be sharing our experience of heading off the tourist track to visit Bhutan's most traditional cultural festival.
Until then, Obhi and I look forward to reading your reflections about this episode in the Waterfall community.